Hello, everybody. This is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You are watching Aging Strong under Health Links. This program is sponsored by the Quincy's Health Department. And today's guest is Melissa Enos, and she works for the Massachusetts Executive Office of Elder Affairs. She is the home care and political analytics nurse. That is actually a mouthful. Melissa, welcome.
Thank you. Thank you, Debbie. I'm happy to be here.
So today you're going to share with us information about fall prevention and also different available services out there for the older population, right?
Yep.
Awesome. Before you do the screen share, can you just tell us a little bit about you and how you got into doing what you do for the Massachusetts Elders Affair?
Sure. So I'm a registered nurse, and my background has been everywhere from working in a hospital and assisted living, nursing facilities, memory care. And then I came to the Executive Office of Elder Affairs. I've been working there for 6 years in my role. And so we like to do a lot to recognize preventing falls. We find it's important because our programs are specifically in the homes and out in the community. And so we have eyes and, we're firsthand in people's homes, and we have a good rapport with our consumers. So we think it's very important to highlight fall prevention measures.
Yeah, definitely. Very, very important. So I can't wait to listen to what you have to share with us today. So when you're ready, go ahead.
Okay. All right, I will share my screen. My name is Melissa Enos, and I'm the Home Care and Program Analytics Nurse at the Executive Office of Elder Affairs. And today I put together a short presentation for you in regards to raising awareness on falls prevention. I'm just going to... Oh, there we go. So falls and fall-related injuries are a major threat to the well-being of older adults and their ability to maintain independence. Each year, more than 1 out of 4 adults age 65 and older fall. 20% of those falls have caused serious injury. That's noted from the Centers for Disease Control. So that's a national statistic. 1 in 4 adults over the age of 65 have a fall every year. In 2021, 79% of the home care consumers, and I'll talk a little bit more further down the presentation about what the home care program is, but this is a statistic pulled from our data. So it's within Massachusetts residents. 79% of the home care consumers assessed for falls were flagged as having a fall. Flagged as having a fall risk indicated. Of those flagged, 51% accepted falls-related education, a referral, or an intervention. So mitigating the risk can reduce the number of falls. A proactive approach is a great way to reduce falls. And a couple of ways that you can be proactive to reduce your risk of falling could include identifying potential risks, using preventative measures or interventions, receiving fall prevention education, by reducing environmental hazards, exercise, or staying current with your health care, such as taking the correct medications that are prescribed to you, keeping up with your routine doctor's visits, eye exams, hearing exams. All of that can help you be proactive at preventing falls from occurring. So I'm going to talk a little bit about falls risk factors. So fall risk factors, they are characteristics or situations that can increase a person's chance of falling. There's typically 3 categories: biological, behavioral, and environmental. I'm just going to go over a couple of the biological risk factors. So if you have any of these risk factors, it just puts you at you're at a little bit higher of a risk of having a fall. So it's important to recognize this. And if you do find that you do have some fall risks, you might want to think about, what can I do to prevent my falling, or what can I do to decrease my risk? Unfortunately, the biological risk factors, some of them you can't change, such as your age. So a biological risk factor is anyone over the age of 65 is at higher risk of having a potential fall. Any confusion, dementia, depression, anxiety, those can all lead to having a risk for having a fall. Muscle weakness, unsteady gait or walking, or balance problems. If you become dizzy when changing positions, that could put you at risk for falls. So it'd be important to if you do become dizzy when changing positions, to change positions more slowly, and also notify your physician of that. Any medication side effects or interactions, taking more than 4 medications a day, chronic health conditions such as Parkinson's, MS, arthritis, heart failure, history of stroke, vitamin D deficiency, poor vision or hearing. So it's important to make sure you're following up and keeping your appointments for eye doctors or audiologists, that you're using your aids like your glasses or contacts and hearing aids. The loss of sensation in your feet, also called neuropathy, leg swelling, foot problems or pain. Any recent illness. So if you recently, laid up for a week, or you had the flu or a fever, or if you're in the hospital and then you come home, you're probably not feeling yourself right away. You could have a little bit more weakness that could put you at risk for a fall for a short term until you get your strength back. Any acute neurological event such as a stroke, and like I said, the recent hospitalization. A history of at least one fall, which you're at higher risk of having another fall. Urge incontinence, that's having to hurry to use the bathroom, and problems with blood pressure, such as high blood pressure or low blood pressure. Then we have behavioral risk factors that can put you at a higher risk of having a fall. So one behavioral risk factor would be inactivity. It's really important to try to be active each day, even going on walks or doing a light activity, light exercise. If you're immobile, you tend to become a little bit more weak over time, and it could put you at higher risk for having a fall. Risky behaviors, such as standing on a chair in place of a step stool. So if you're trying to reach the top cabinet to get your baking dish on the top shelf, you really want to take the time to find a step stool or something that's sturdy to step on, not a chair or climbing on the counter. That you just want to make sure you're always have your safety first in mind. Any alcohol or substance use could lead to higher risk for having a fall. Behavioral manifestations of distress that can lead to use of psychoactive medications. Poor judgment, such as if you're going outside and it's icy and snow and it's full of snow, you can slip on the ice. Or furniture walking and grabbing onto the furniture when you're walking. That puts you at a higher risk for a fall.
Behavioral manifestations of distress. Can you give us like a quick example of that?
Behavioral manifestations of distress that could lead to psychoactive medications. Mm-hmm. That would be like if you needed additional treatment for additional psychological treatment, mm-hmm. Potentially having a Jerry psych admission or
okay,
something that would something that would lead to putting you on some of the psychotropic medications that put you at higher risk for falls.
I see.
So some medications can put you at a higher risk of falls because they can, there's changes that going on in your body. They can make you feel dizzy, some of the side effects.
Okay. Yeah. Okay. That makes sense to me. All right. Very good. Thank you.
Yeah. Okay. And then we'll talk about the environmental risk factors. So, of course, any clutter or unclear pathways or uneven floors put you at a higher risk of falling because there's a lot of trip hazards. Oxygen tubing, it is again a tripping hazard. Broken steps or floors in poor repair, poor lighting, loose rugs, broken handrails, electrical cords or other hazards, lack of adaptive equipment, such as grab bars, wet surfaces, unsafe or improper fitting footwear, wearing socks instead of shoes, or pets or small children that could be running around your feet. So I'll just touch a little more on the footwear. It's so important to make sure you have good grips on your shoes, that they fit correctly, that they're buckled in properly. Flip-flops can be kind of tough, when you're walking around in those, but
yeah.
Okay, so now I just wanted to brief you on the Massachusetts Executive Office of Elder Affairs, which is the office I work for, just so you kind of get a little bit of information where I'm coming from. The mission of the Executive Office of Elder Affairs promotes the independence, empowerment, and well-being of older adults, individuals with disabilities, and their caregivers. So we have a couple of different departments in Elder Affairs. We have the home care program, which is the department I work for. We have protective services, assisted living certification unit, and then the intake and referral program, just to name a few. So within the Executive Office of Elder Affairs is the home care program. The home care program provides care management and in-home support services to help older adults, people with disabilities, and people with Alzheimer's disease or related dementia successfully age in place within Massachusetts. Services are based on assessed needs. So for the home care program, there's a lot of different programs that you could be eligible for, and the services that you're eligible for are based on an individual's need. So the Executive Office of Elder Affairs contracts with 24 aging service access points, and these are the contractors. They're also known as ASAPs, so I'll be referring to them as ASAPs going forward in the presentation. These ASAPs contract to run our home care program. So there's 24 and they're statewide. So that means each ASAP is responsible for a certain amount of cities and towns in their area, and that's their coverage area. So you might have heard of your local ASAP, or maybe you've been in a nursing facility in a different town. It's covered by, that would be covered by a different ASAP. But they all are able to provide the same services throughout the state. Besides the home care program, they offer other services as well. Today, I'm just going to be talking about the home care program, and the main functions of the home care program is information and referral, nutrition, care management, care and support coordination.
I know people who are utilizing the home care program through South Shore Elders Affair.
Yeah.
And I got to tell you, it's a game changer for those people. It's just such a wonderful program. So, yeah.
Oh, that's wonderful to hear.
Yeah.
The local ASAP for Quincy, the Quincy area, is South Shore Elder Services. And I do have a slide towards the end with their contact information. But I thought that would be helpful for the viewers since they're most likely in the Quincy area.
Mm-hmm.
Their local ASAP would be South Shore Elder Services. Yeah.
Yeah. And if they're not in the South Shore area or live in Quincy, will you be able to also give us information, for people who live in the Cape and the Islands, or people who live in the Berkshires, Worcester area? Is there like one website to look into, and then they can plug in their zip code?
Yep. I'll show you that a little bit towards the end of the presentation. We'll hop over to the website and I'll navigate it through and show you a couple different examples of different towns from the state. So it's pretty user friendly to find your local ASAP. Yeah.
Great. Thank you.
Okay. So this is a list here of the home care programs that are offered that are related to falls prevention. So we do have additional services that are offered through the home care program, through the ASAPs. But these specifically are in relation to a falls prevention. So if you were we refer to them as our consumers in the home care program, you could be eligible for a cellular PERS emergency response system with falls detection. So that would mean those are those little buttons that you wear on your wrist, or I've seen like a necklace. And it's an emergency response system. So if you did, need help, you'd press the button. Some of them have falls detection. So even if you fell, it would notify an emergency response. We have chore services, which is helpful for falls prevention, to like declutter your home if you needed the assistance. Housekeeping, things like that would be under chore services. Complex care training and oversight is skilled nursing. So if you needed additional assistance with a skilled nurse to help out with maybe some of the med side effects or the dizziness or something like that for falls prevention. Environmental accessibility and adaptation is a service. And so that is kind of what it sounds like, is that the ASAP has a service that they would coordinate to have your home adapted to help prevent falls, or such as they can have handheld shower faucets installed, tub seats, transfer benches. So it'd make your home a little bit more safe for you as an individual, and also decrease your risk of falling. There's evidence-based education programs, and I listed a couple of here that are related to falls. So Bingo Size, Enhanced Fitness, Jerry Fit, Matter of Balance, Strong for Life, Tai Chi, and Tai Chi for Healthy Aging. So those are some programs that you can sign up for. Like Matter of Balance and Tai Chi are kind of like exercise programs that are really focused on preventing falls. And then with each home care assessment that we do, so if you were in a home care program, depending which program, you would have a certain amount of assessments done by your case manager or a nurse a year. Typically anywhere from like 2 to 4 assessments a year. But with each assessment, the nurse and the case manager does a fall risk screen, and that would automatically flag for them if you are identified as a fall risk. And then they can provide education on local resources, or talk about interventions that you might accept and be willing to have in your home. So this would be customized fall prevention, education, and interventions. And it's really designed for an individual. Okay, so it's what's going to fit your needs. And also, do you want the handheld, the grab bars in your home or the handheld shower faucet? It's totally up to you. We're here to help guide you and share resources.
Yeah.
Yep.
Quick question. Now, how, if, somebody who's never heard of the elders, Office of Elders Affair, and they look at this and they say, oh my gosh, I want all these. This is great. How do I sign up? Who is their contact person? Would they go to their senior center? Do they just go online? Who is the best person to reach?
So towards the end, I'll have, so we have the website.
Okay.
There's also a phone number that I'll give out. And it's basically, if you called the phone number, you can just they'll probably want to know what city or town you live in, because that's going to depending on what city or town, that's what ASAP's going to help you. That's what the towns they cover. So for example, they would let you, like if you lived in Quincy, they would say, well, South Shore Elder Services, that's their coverage area. And so then they'd give you a phone number to South Shore. You can call South Shore Elder Services, and then you would go through their intake and referral line, and they would kind of pre-screen you, see, what you're looking for. Say you called up and said, I'd like some homemaking services. Then they would connect you over with a care manager, and a care manager would reach out to you.
Oh, great. Thank you.
Yep. So a couple of the other programs that are available are the Goal Engagement Program, Homemaking Services, the Home Safety Independence Evaluation. So that's an occupational therapist eval for your home. They can come in and make some recommendations to make your home a little bit safer and decrease the fall risks. Orientation and mobility, the personal emergency response system, personal care services, physical therapy, transitional assistance, and vision rehab. So it's a lot of services. It also depends. You do have to meet the programmatic requirements for these. So I will go over a couple of requirements in this presentation, but not like totally in depth for all of them. Okay. So the home care eligibility, to be eligible for any of the home care programs, there is an age requirement. You have to be 60 years old or older, 60 years old or above, or if you're under age 60, if you have a diagnosis of Alzheimer's or related dementia disorder. So those are the age requirements. And then there's also a residence requirement. You do have to be a resident of Massachusetts to be a part of the state home care program. And you cannot, the home care program you're not eligible to be in the program if you are in an institutional setting. So if you're like in a nursing facility or an assisted living residence, we're just, it's per the regulations. So if you're in the community and you're in your home and you live in Massachusetts, then you would meet the residence requirements for the eligibility of the program. So I've included a full list of the home care services that the ASAPs can provide. The previous list was just focused on our fall prevention, but this is an entire list of our services. So they do have, they do contract with Adult Day Health, and that can be a part of your care plan, if it's needed. It's based on needs. If you need to go to Adult Day Health, once a week or so. They have Alzheimer's, dementia coaching, behavioral health services. We talked about chore. They have companion services, electronic comfort pets, which is relatively new, and We are fans of that one. Have you seen have you seen any electronic comfort pets?
I've never heard of it. Can you
Oh.
tell us a little bit about that? That sounds really awesome.
We were very excited about this one. They're like they look almost real, and it'd be like a little cat or a dog, and they kind of just like sleep in your lap, but they look like they're breathing, and they're very lifelike. And there's been studies that have shown that it's very calming for people maybe with a dementia or anxiety. It helps calm people. But so we do have it as a service to have an electronic comfort pet.
Wow. What does non-waiver only? What does that mean?
Okay. Yes, good question. So one of the programs that we have as a home care program is the Frail Elder Waiver program. And so that's the waiver. So this is not a service this is not a service that would be used in a waiver program. So if you were in the Frail Elder Waiver, unfortunately, you would not be eligible to have the electronic comfort pets. But if you were in the home care program, then that'd be eligible for that service.
Okay. And how does that work? Do they plug the pet in, or do they?
So I think there's a lot of different. So each ASAP has their own contracts. So there's a lot of different companies that you can contract with to get the electronic pets. So it's probably a lot of different ones.
Oh my gosh, that's so fascinating. That's great. I love it. I love it.
So then I talked about the environmental accessibility adaptations and the evidence-based programs. We have grocery shopping and delivery services, home-based wandering response systems, home delivered meals, home delivery of prepackaged medications, home health aid services, laundry services, medication dispensing system, nutrition assessment or counseling, peer support, respite care, supportive day programs, supportive home care aid, transportation, and vision rehab. So there's a lot that we can help you with.
Can you just quickly distinguish the difference between a companion and a personal care attendant or personal care person? Yeah. What is the difference between the two?
So personal care is more like hands-on assistance, where like if you need assistance with a shower or dressing, any of your your daily activities, that would be more personal care. A companion is more of somebody like to be there supportive. It's no hands-on, but it's just to be your company.
Okay, just an in-person guest, yep. Like visitor. Yep. Oh, okay. Yep. That's good.
Okay, so now we're here about how you can make a referral for services. So I have here a screenshot of the Mass Options. And so that's the website that we use to do any referrals. And so I'm going to switch over to that website because it's a little bit easier.
Great.
To see here. Okay, can you see the website?
I can see it says 4 easy ways to reach us. Yep, I see the website.
So this is the Mass Options website. It's Mass, MASSOPTIONS.org. So massoptions.org is their website. Hmm. So there's 4 easy ways to reach us. You can call anytime. So the number that you can call for a referral, well, not a referral, sorry. You can call the number to find out who is your local ASAP. And that number is 800-243-4636. So again, it's 800-243-4636. And that's normal business hours, 9 to 5, Monday to Friday. There's a function here. You can, if you choose to go to the website, you can chat online with a specialist. Again, Monday to Friday, 9 to 5. I thought it'd be easier to show the website for the referral.
Yeah.
So if you want to look at local services or complete a referral, you could come to their website and you click here. And so they can provide you with contact information for an agency that will help determine your needs and work with you to find services and support. So they have a list here of different agencies they can help put you in touch with. Today I'm talking about the ASAPs, the Aging Service Access Points, but they also have information on the Independent Living Centers, Department of Mental Health, Department of Developmental Services, and the Mass Rehab Commission. So today we're talking about ASAP. So I'll just click on ASAPs and then select your town or city. The first one's Abington, and then you'd submit, or you could do questions and you could submit kind of like an email, and then they'll return your question. That can help you find your local ASAP. But here's locations in towns. Yeah.
That's great, though. It's nice that you showed us the website for mass options. So now people will be able to, have a go-to number or a website to look to see what's available for them, who's covering their area. So that way they can begin their journey of, getting the services that they need. That's fabulous.
Yeah. So that's a starting point. The website too, you're a couple clicks away from, it's not as fancy as pulling up yourself, but it kind of shows you, like for example, age span, and this is all the cities and towns that they cover here. And then there's their website and their phone number right there. Mm-hmm. So, and then like if you lived in Ashburnham, you would see right here that Aging Service in North Central, Massachusetts is the ASAP that covers your area. So there's a couple different ways to see it. So I will pop back over to my PowerPoint.
That's great.
Okay. Can you see the PowerPoint now?
Not yet. I see mass options, 800-243.
Oh yeah. Yeah. That's my side.
Oh,
so,
okay.
Yeah.
It's
just a screenshot from the website there. So this is what we just talked about. You can call, chat online, the referral. And then if you wanted to submit a question by email. And then this is what we had went over before. You would select ASAP in your city. So I included South Shore Elder Services. For those of you who live in Quincy, this is the local ASAP. And they provide services in Braintree, Cohasset, Hingham, Holbrook, Hull, Milton, Norwell, Quincy, Randolph, Scituate, and Weymouth. So you can kind of see that they have their own little sections of the state carved out, and that's their coverage area. I listed their address. Their main phone number is 781-848-3910. Again, it's 781-848-3910. They have an Asian info line as well as a Haitian info line as well. That's what I had for today. I hope everyone learned something or found it helpful.
So I do have some questions. Can you come off of the screen share or?
Oh, sure. Yep.
Yeah. And I know this is like one of the most common facts out there from the CDC is 1 out of 4 adults 65 and older fall. Do you think it's higher than that? Because of, I hear, people or even read some information saying that falls are underreported. And do you feel that since COVID also has happened, people have, especially, you know, there's some populations who have become fearful of going outside and their daily routine has been turned upside down and they're not as active? Do you have any information on that as far as the numbers of falls, any more recent data on that? If not, what are your thoughts?
So I completely agree that a lot of falls do go unreported. Just from my own personal experience, they'll have a fall, but when questioned about it, they'll say, "Oh, well, I just slipped. That wasn't a fall. That I slipped." Or, "Well, I just lost my footing. That's not a fall." But it is. It's a fall. So I do think, and then of course people fall and they get back up, they think nothing of it. So it's not going to be reported. You're not going to go see your doctor over that. So, and you probably won't report it to your doctor. So I think a lot of falls are not reported. So that's a high percent, 1 out of 4. And especially when we suspect that's not everything is reported.
Right. Yeah. I mean, there's many different reasons, I'm sure. Like, you know, people don't want to be seen as somebody who is old, you know, frail, or
yes,
again, you know, that their own understanding of what a fall is. Well, I didn't hurt myself. There's no bleeding. There's no bumps. There's no bruising. I got up. It's fine.
Yeah. Yeah. I mean, people fear that they're going to lose their independence. So we really try, you know, for our goal as the home care program and the ASAPs is to keep people in their homes if that's where they want to be. You know, we focus our care and our coordination, our case management around a person-centered approach. It's all about what does the person want, what's their personal goal, and how can we help them. So that's our, you know, our main focus there.
Right. Yeah. I was, I one of my roles as the Tufts Medical Center's injury prevention coordinator is I go out, I do a lot of outreach work, and I do a lot of fall prevention workshops. And this week I was at the Braintree Council of Aging and I was doing a program, and one of the participants who is newly retired, and she's very agile. She's just very, you know, can I get coffee for everybody? So she went to the kitchen, got coffee for all the participants. But she told me, she said, you know what, I was proactive. She sold her home and she decided to live in a complex, in an area where there's older adults, because she was already anticipating that in the future, she's going to need a one-level living situation. She didn't want to have to worry about steps, and she wanted to make sure that her cabinets are within reach, and, you know, everything set up so that as she gets older, she is creating an environment of success, because that's one of the risk factors you talked about was, besides biological, behavioral, there's the environmental, and that's very, very important. Yeah.
I mean, there's a lot of simple things that you can do even in your own home to decrease your environmental risk factors, like throw rugs I know they're so pretty and decorative, throw rugs, but a lot of people trip on them, and you really gotta, you know, question, is it worth it? Are you at a high risk of falls? Maybe the throw rugs, maybe it's time to go. Like electrical cords or oxygen tubing, those are some things to recognize, that those are easy to trip over. Pathways, make sure the pathways are clear. Those are some simple things that you could just look around in your own home. I've given quite a few falls prevention and falls interventions talks over the years, and I do love this video that I'd referenced before, and I always remember in the video it says, don't use your staircase as a shelf. because it's like, oh, that's what I do like all day. I'm like, oh, this needs to go upstairs. I'll just put it on the stairs the next time I go up. And then, everybody keeps walking past it. But so that's one thing too that sticks out to my mind is,
Yes.
don't store things on the stairs.
Yes, yes. Oh, yes, I've done that. As a reminder, okay, I'll put it over here on the steps by the banister just to remind me as I go upstairs to bring it upstairs. Oh, yes, I've
Yeah.
done it. I'm guilty of that. But as we get older, that type of behavior leads to an environment of clutter. So that's something I myself have to remember. I have to remember that. I wanted to ask you a little bit more about, you gave us a list of home care programs and fall prevention, and it was really a wonderful list. And there's some I didn't even know was, part of it. And on the list is physical therapy, transitional assistance, and vision rehab. Can you talk a little bit more about those three?
Sure. So physical therapy, the ASAPs can contract with a physical therapist to come into your home and to work with you. So based on your needs. Transitional assistance is a program that helps people who are in a nursing facility return to the community. So say you fell at home, and you had to go to the hospital, and now you're in rehab to get stronger. Now you're in a nursing facility, and there's some roadblocks maybe or some barriers to discharge, and you're going to go home with services because you need a little bit more help in the home than you did before. So you could be looking at enrolling as in a home care program, and traditional assistance would help you transition from the nursing facility back into the community. So there's a wide list of what could be put in there. It could fall under there. It could be like grab bars or handheld shower faucets, something like that. But it could also be like a ramp. Like if you wanted to go back to the community, but you are now wheelchair bound and you could not get into your house because you have 2 or 3 steps and you need a ramp, they could put a ramp in for you. They could have it installed, and the ASAP contracts for that and coordinates that to be put in. So that's transitional assistance.
So is that covered by insurance, or is that covered by the sliding scale that the person pays for when they become a consumer? I'm not an expert on the funding. I'm more in the nursing role, but that is, I believe there's a certain amount of money allotted for those programs. And when you're in a home care program, there's a cost share table. And so it depends on, and so what it looks at is your income, like for one person's income or for a 2-person household income. And then there'll be a percent of if your income is this amount, then you would be responsible for like 10% of your services, something like that. So there's a cost share table. So you may have a copay. There is a line where there is no copays for the services. So it depends on that. It depends on what program as well. Okay.
For all the financial.
And the physical therapy, do you need your primary care doctor to write an order, or
Nope.
that goes through the case manager? Because
that's through the ASAP. The case manager will coordinate if it's determined that you have a need for physical therapy. You don't need a doctor's order because it's not going through your insurance. The ASAP is the funding source.
Wonderful. And the vision rehab?
That's another one. I'm not an expert on that one, the vision rehab. So I really can't say too much on that one. I'm sorry.
Oh, no, that's
out
fine.
of my realm. It's
fine.
included in our programs, but
yeah,
not something I have hands-on experience with.
So I'm thinking about so the people who are eligible, they're 60 and up. And
Yep.
under 60, they have to be diagnosed with either Alzheimer's or dementia.
Yeah.
Any other disabilities if somebody was younger than 60, but they do have a disability? Like say somebody who is 40 and they just all of a sudden suffered a stroke and they have hemiparesis, left-sided. And they were fully functioning, and then now they're at home. They used up all their physical therapy hours based on their insurance. They can't work anymore. Are they eligible? Or do they have to be of age 60 and up in order for them to then become eligible?
Yeah, so they would have to be older than 60. But I believe there are other state programs that they might be eligible for.
Oh, okay. All right.
But for the home care program, it's over 60 unless you have the Alzheimer's or dementia.
Got it. Okay. That's very good. That's nice and clear. Awesome. So we're almost we're at the top of the hour pretty much. You gave us such a wonderful presentation, letting us know what's available for people who are, 60 and up. We all know that the population, the lifespan is getting longer. And with that comes many, I'm sure a lot of requests for assistance to be able to age in place, because a lot of people are wanting to live the rest of their lives in the home that they pretty much spent most of their lives. And so I can imagine the need for, ASAPs and home care and many fall prevention initiatives out there. Is there anything that you want to impart before you leave us now? Is there anything like one or two key information that you want us to really digest and be able to kind of take away from your presentation today? Because it was such a great presentation. And thank you, Melissa.
Thanks for having me, Debbie. We're always happy to spread the word about our services, so people are more in the know in their community. I think one thing it's important to take away, just like if you want to be involved in a home care program, certainly reach out with the website, or you can call the number that we had mentioned before. But it's important to know that it's what you want. It's very consumer driven. It's your goal, and our goal, is to help you and to help you thrive in the community and to stay in the community, stay in your home for as long as you can. And a big portion of that is preventing falls. So we like to make sure we raise awareness on that and put recognition on, just some simple things that you can do in your home to decrease your risk so that you can stay there for as long as you want to stay in the community. So just that. And thank you again for having me on your show. And I really appreciate it. Thank you.
Oh, thank you, Melissa. Thank you. And I also want to thank the Quincy Health Department for continuing to sponsor this program. Until next time, take care, stay well, and be safe. Bye-bye, everybody.